Hi, I'm Jocelyn Alt. In this video, I'm going to be talking about the first component of the Affordable Care Act, rules for the individual market. Pre-ACA, no guaranteed issue. This is the word for when insurance companies have to provide a plan to a customer who applies. Before the ACA, insurance companies could deny at their discretion any customer. The ACA said no longer allowed. Insurance companies, you have to accept people who apply, and we're going to provide, as the federal government, financial assistance on a sliding scale based on income for people to purchase a plan directly from an insurance company. Before the ACA, there were no exclusions on pre-existing condition exclusions. There were no limitations, I should say, on pre-existing condition exclusions. A healthy person could apply, and the insurance company could say, okay, we're going to charge you, say, $200 a month. If a sick person applied, someone with a pre-existing condition, diabetes or any other chronic disease or a broken leg in the past, or even someone who is pregnant, I'm pregnant now, I could get denied by that insurance company, or they could they could choose any price they wanted to charge me, say $2,000 a month, for example. The ACA said no exclusions on pre-existing conditions, both for healthy people and people with a pre-existing condition. Number one, you have to accept them, and you have to charge them the same rate. This is really important distinction, because even when there's discussion now of keeping the limitations on pre-existing condition exclusions, we have to be careful that it's not just that they are required to accept people, but also that they're not allowed to charge them exorbitant rates that they couldn't afford anyway. Lastly, pre-ACA, there were limited insurance requirements. So insurance companies were allowed to place annual and lifetime caps and benefit restrictions in their plans. And often this was really in the fine print. People often didn't realize that their plans had, say, a $10,000 annual cap. So once their healthcare costs had gotten to $10,000, the insurance company wouldn't pay. Once their lifetime expenses had gotten to $100,000, the insurance company would stop paying. The insurance company might say, we'll pay for 3 physician visits or 10 days in the hospital, and after that, you're on your own. And these are things that caught a lot of people off guard, because a lot of people don't have a sense of what it really costs if you get a chronic disease or you're in a crisis medical situation. And this is what led to a lot of the bankruptcies for people who did have insurance. So the ACA said that's not allowed. You cannot put annual caps on benefits, and you have to cover required essential benefits. That's the point of insurance, to protect people from catastrophic illnesses and accidents. So let's talk for a minute about the individual mandate. I talked about guaranteed issue and elimination of pre-existing condition exclusions. The individual mandate is really a third leg of that stool, and here's why. If you allow people to go without insurance, and then when they get sick, they have guaranteed issue and no pre-existing condition exclusions, there's nothing to keep people from, when they're healthy, going without insurance and then signing up for insurance when they get sick. And you can imagine that type of insurance system doesn't work, because you need people paying into the system when they're healthy to get benefits when they're sick. That's why eliminating the individual mandate is so problematic and so difficult from a policy standpoint based on this structure.